Hello everybody, I hope this finds you well. You'll see from the backdrop that I'm out and about today at University Hospital Wishaw, and it's a lovely day. Quite nice to be outside, even just for this brief few minutes to do the video. I'll start by talking about the case numbers first of all, and then I'll say a bit about some of the difficult decisions that we've had to make over the last 24-48 hours in relation to the pressures that we are experiencing now right the way across NHS Lanarkshire. So I'll start with the numbers. New cases yesterday came in at 372. We currently have 46 inpatients across 3 acute sites, and we have 5 patients in ICU. 1 patient having CPAP, and care home outbreaks, we have 1 outbreak at the moment. In terms of vaccinations, we've now vaccinated 488,000 people and delivered 843,000 vaccinations in total, and NHS Lanarkshire is well on track with its vaccination programme. In terms of the new case number, that number yesterday was a slight increase. We had seen the rate of increase in the new cases beginning to slow down a bit, and I was hopeful, I'm always hopeful, that was a sign of things beginning to peak in terms of this third wave. However, I think we're still kind of holding our breath a bit about that. I am still hopeful that within the next 2 to 3 weeks we will begin to see the new case numbers and therefore the hospital admissions start to plateau a bit, so that would be good news, I think, for everyone. Meantime, we are under a lot of pressure. The system is under probably unprecedented pressure. I've never seen the numbers that we've seen at our A&E departments over the last couple of weeks at this time of year. In fact, the number that we're seeing presenting to our 3 EDs is higher than at any time. The numbers that I've seen are certainly the highest I've seen in my career here in NHS Lanarkshire. We discussed the pressures right the way across the system today at our Gold Command meeting, which we held as an emergency today, to think about what we could do, firstly to redeploy staff across the system to support the demand, and secondly to see if there's anything we can stop doing. I think the pressures are really as a result of 2 or 3 things. We have seen the COVID numbers begin to come back up, but they aren't as high as they were in either of the previous 2 peaks. So they are increasing, but they're not unmanageable. However, remember, we're trying to maintain our services. So at the same time, we're trying to rebuild our elective programme. That's all the patients that were booked for treatment, many of whom have been waiting for quite a long time now. The third pressure really is around our workforce. We've got lots of staff who are off for annual leave at this time of year, and also quite a few now who are self-isolating, and that's giving us another pressure right the way across the system. So we've had some difficult decisions to make, and I'm really grateful to the team who've pulled out all the stops to think about what we can stop doing. And sadly, that is some things like teaching and education. Some of those non-front-facing clinical staff will be redeployed into clinical areas. And now, unfortunately, this is a difficult decision for all of us. We have decided to cancel some of the elective activity, the planned care activity here at Wishaw for the rest of this week to free up staff to support the delivery of safe patient care. Our new case is testing positive. I just wanted to say a bit about that because that's somewhere where, as our staff, I think you can help us. Most are in the 19 to 39-year-old category at the moment, and we're now seeing that also reflected in our inpatient numbers, sadly. So we're seeing younger people coming into hospital. About a quarter of our inpatients at the moment are people in that age group. So I would stress, if you can reinforce the messages with younger people, just ask them to protect themselves. If they're going out, take a lateral flow test first, maintain their space, wear their masks, see what they can do to prevent themselves from getting this horrible disease, because I really don't want to see any more of them in the hospital. The other thing you can do is to encourage vaccination. The uptake in the younger age group, the 19 to 39 year age group, has not been as much as we would have liked. So if you do know anybody in that age group who hasn't been vaccinated, please encourage them to come forward and get their vaccination. There are numerous opportunities on the website listed where they can just drop in and get that first vaccination and give themselves some protection. So I would urge you to do that. I'll finish there today, and I'd just like to say thank you again to everybody for everything that you're doing, and I do appreciate these are difficult times at the moment, but I am hoping that we will come through it. Thank you.